Well, it's definitely a fun time in the studio this morning. Of course, we're going to be talking about Top Dogs Therapy. Yes, we've got dogs in the studio, and in just a short moment, we're going to be having a conversation with Dr. Connor Hughes, really looking at the benefits of canine therapy. We've got our two canine friends joining us this morning, Emin as well as Jinx, as you can see, waiting really to shed some light in terms of the benefits of having therapy. So that conversation will be happening with Penny in just a short moment, and we invite you, as always, to be part of our discussion. Remember to give us a call, or otherwise you can simply leave your comments on Facebook as well as on Twitter. I just want to say to you, the dog that you're currently seeing on the screen, his name is Emin, and I must tell you, it looks literally like a horse. I just want to actually show just how big this dog is compared to me. Can I show them how big this dog is compared to me? Absolutely massive. Can we see if we can get Emin to stand up a little bit? Absolutely big. Can you imagine this dog in dog therapy? He really is a big dog. And of course, we're going to be speaking about the benefits of such a therapy, and also how does it help people that are traumatized? How does it help kids? How does it even help you at home? Really innovative stuff that is coming out, and do stay tuned for that conversation. However, it is a Hope Day Wednesday, so a better way to find out how to kickstart your day this morning and to find out exactly what you can expect on the traffic front, Irma G is standing by to give us the latest. Good morning to you, Irma. Happy Wednesday.
Good morning, Faith.
Welcome back to Sunrise. As we continue this morning, we have a few friends who have been providing animal-assisted therapy, animal-assisted activity and animal educational programs to adults and children. Now they're joining us, of course, to tell us more how man's best friend has been providing therapy to the public is Top Dogs Therapy Vice President Dr. Connor Hughes and Top Dogs Therapy Handler Dr. Claire Ensign, and Eamon as well, who is an Irish wolfhound as well as okay, this is Jinx, right?
Yeah.
Okay, is Jinx a cover? What is a cover?
No, she's an Australian
She's an
Shepherd.
Australian Shepherd.
That's right.
Okay. All right, let's just get that right. Okay, so thanks, Doctor, for joining us this morning. First of all, before we even get to what these Top Dogs program are all about, me and you were just talking off air how different dogs can be skilled differently to do different things. Okay.
The important thing is these are therapy dogs. They're not service dogs. So people often think when we say therapy dogs, we mean things like guide dogs for the blind or hearing dogs for the deaf, service dogs for people who have epilepsy. Those are very skilled dogs, and they're trained in skills for a specific purpose, and they work usually with one person only.
Okay.
What we have here are therapy dogs. This is something that is very widespread in America. We are in our early days with them here. You can think of them as comfort dogs. We do therapy with them a lot around stress, around stressful situations, so they don't have the specific skills that a service dog would have, being able to guide a blind person around, for example. But what they do is they have extremely good natures. They love people, they're very good around other dogs, and what the amazing thing about these dogs is, with any dog, with somebody who enjoys animals, there is a kind of magical scientific thing that happens.
That happens when you're in their presence.
Absolutely. If you sit with a dog like this, who is so good-natured, so comfortable, and you just sit and you pet it, the amazing thing is your blood pressure will drop. And we've actually had that in one of our visits with a lady who was, a very old lady, who was sent straight back to her room by the nurse, who said, "You mustn't be out of bed. We took your blood pressure. It was sky high. You'll collapse." She went back to her room and called the nurse and said, "Please take my blood pressure," and it was normal. And that was the time spent with the dog. So these are comfort dogs, therapy dogs. They reduce stress. They're also very motivational for example, we do a lot of work with young people who have brain trauma, and we work with their therapists to motivate them.
I was going to get to that just a bit later on, but now, okay, how do these dogs provide animal-assisted therapy? How exactly does it work?
What happens is, with therapy, we actually work with the physical therapists, and it is about a motivational thing. The children who have neurological trauma, very often it's hard for them to want to put in the effort to learn to move their bodies again, to learn to speak again. We had a lovely example with Eamon, at a paediatric rehabilitation unit.
So this is for children?
This is for children.
Yeah.
It was a young boy of about 10 who he'd been working for 3 months with the therapist, residential, and they couldn't get him to speak. They knew he could speak, but they couldn't get him to speak.
Because of trauma, yeah.
And the children get very stressed. Children do experience a lot of stress. And when he first met Eamon, by the end of the 45-minute session, he was speaking his name because he so wanted to communicate with the dog.
Yeah.
So that, and the therapist said, we've spent 13 weeks and we have not been able to get this child to speak, and now within 45 minutes, because it's that motivation, that wanting to. And that's the kind of thing we can achieve working with professional therapists with the dogs.
You spoke about how this is a new program coming into South Africa. How did you come across it, and why did you think, I mean, life is generally very stressful.
Absolutely.
And I think you just have to look at, like, you know, because I'm into therapy and alternative healing and all that. I think we live in a very traumatic, we come from a very traumatic history as a country.
Yes.
You know, and some of us know how to cope with it, some of us don't know how to cope with it. Why do you think this kind of therapy is important for this time in our country?
I think it's the kind of therapy which is all around us. We love to work with the children. I wish we had more people so we could do more work with the children. What I believe is, if we can bring up our younger generations to relate to animals as loving, beautiful things, not as dangerous or aggressive, there is a source of therapy. Everybody, all the handlers, we know, we live with dogs who give us therapy. They give us therapy every day. It lowers our blood pressure. We're healthier for sitting with a dog like this and just quietly being there. So if we can get that message across to a country where there is such a need, if you have a pet, it can be a rabbit, it can be a goat, it can be a bird, it can be anything. There is this magic which reduces our stress hormones and raises our good, positive hormones. This country needs that, and yet we are often scared of these animals. We need to turn that on its head, because this is kind of for free.
Okay, so Dr. Claire, you're a dog handler, okay, and I'm sure you've handled different types. What makes these particular therapy dogs very special?
I think it's the size, first of all. Size is like, wow, you know, you have a little Pekingese and then you see him, it's like, that's so much more. But he's just gentle. He's really, really gentle with looking after children and being with them.
Okay, so in terms of like the trauma, when you spoke about when you're dealing with patients who've had to deal with a lot of trauma, is there a way of how it has been proven what makes it scientifically to work to help those kind of patients come out of?
Yes, there's an enormous amount of research being done on exactly what happens when we work just with comfort dogs. There are 3 basic stress hormones. Let's not get too technical about it, but there are 3 basic stress hormones which we need to live, but they should rise at stressful situations and then drop immediately.
Yeah.
And what we suffer from as humans is that those hormones rise and they stay risen.
And they stay risen all the time. Yeah.
So what happens is that when you sit quietly with a dog and just be with it, those hormones drop. And I don't believe there is a scientist who understands why that happens, but it is measured, and it is easy to measure these days. You can do the experiment very simply if you have a simple chemistry lab. We know it works. Not only that, but the good hormones, the ones that make us love our children, the ones that make us not really feel as much pain. You know, a runner's high after you've been for a run. You feel great.
But also there's just a sense of being able to do something for someone, or in this case it's an animal that cannot really do much in return. You just, it takes, something happens to you. Here's someone who does that all the time. Her and her animals are the best of buddies. She doesn't have children yet.
Yes.
These are good training for her, I keep saying, because I have children. Faye!
That's not nice.
This is better than chocolate for her.
This is better than chocolate.
And chocolate is what she does. She's even taken off her shoes.
I even took off my shoes because I love it. Ladies, can I sit in, just
Please
in between
do.
you guys?
Oh my goodness.
Yeah, I love comfort dogs. Hi, baby. Hi, Eamon. How you doing? No, but these are so cute. These are so adorable.
You have a couple of dogs at home, Faith, right?
Yeah, I've got so many dogs at home, and I think for me, you're right. I don't have kids, right? But what I end up finding is that hello, love. Is
Okay,
it brings
that
out
dog
such
is 2 years old. You're a cradle snatcher right now.
I am cradle snatching. He's so cute. So yes, but they do bring out a sense of love and a sense of care. And I mean, who wouldn't love a face like this? It's just, he's just so cute. Yes, babe, you're adorable. So I really do see it working.
Something happened at your house yesterday with one of your siblings with a dog. Because you posted something on Instagram about a dog yesterday.
Oh yes, my sister speaks to dogs. So what she was doing is that,
Yes.
wow, okay then, all right. So clearly he's found his soft spot. So my little sister was speaking to dogs, and they've got this whole little ritual where they actually howl. So it's a very interesting perspective. But I actually have to ask you, Dr. Connor, that how do you do it? How does the therapy in itself work? I mean, I'm sitting here and I'm supposed to have comfort. How would we, if we have to demonstrate it, how does it work?
This is it. This is the demonstration. Do you feel good? Are you smiling
But I love
when he
dogs.
puts his head on your lap?
Yeah, I do. I
That's
genuinely
it.
love dogs.
That is the stress reduction therapy. You are doing it right now.
Sure.
So, but for someone who's fearful of dogs, what would the approach be?
In that case, what we do, and we do quite a bit of this, we have one visit where we work with children who have been physically or sexually abused, and they are preparing to go to court to testify, and that's a very stressful situation. These are children as young as 3.
So they can have a mental block and not,
they are there to do something stressful, to think about going to court, and a lot of those children are very scared of dogs. What the first thing we do is we do this. We sit on the floor, so we don't sit as adults. We take blankets, we sit on the floor with the dogs. The children come and they will slowly start to approach. There is something, particularly if you get a little fluffy one like this, there's something
yes,
very...
Miss Jinx here.
Yes, there's something very appealing at a basic level, unless you have actually been bitten. Children who are simply nervous will tend to want to approach. And once the interesting thing is, once they have got confident with one dog, they will then generalize that out and they will start to get comfortable. And we've seen it over and over again. Children say, no, I'm scared of dogs. And by the end of an hour, they're sitting on this one or with their arms around something, and they're just loving it. And it's the experience, because a lot of children say they're scared of dogs. They've never really
experienced
interacted.
it. Yeah, because Dr. Clay, I'm sure you deal with dogs all the time. And when you're dealing with someone who can say, I'm afraid of dogs, and they've just, it's registered in their subconscious that me and dogs just don't get along. And here you come in with, Aim and Ian here, and then you've got the dog. And how do you deal with that person so that they can experience this animal for what it's got to offer?
There was a little guy at the rehab center that we went to, and I had Emin there, and he wasn't going to touch him. So what I did was I walked Emin past the child, and as he went, and just his tail was there, he touched the tail. A couple of seconds later, walking past again, he touched the bum. A couple of seconds later, walking past, he touched his head. He didn't want to have that big face in his face. That was just too much. But if he was walking that way and he could touch his tail or touch his bum, he was ecstatic. And then eventually we got him to take his head as well.
Oh, wow.
So it was just gentle. It was just walk past and let him reach out and touch himself.
I must actually ask a question. You're speaking about the significance of this, and I'm sure you'd appreciate that it really is an effective kind of tool to work, especially when it comes to children, reaching out to children. But in terms of volunteers, I mean, how are you guys faring in getting the necessary people involved in such a campaign to ensure that more and more lives get touched and more kids get I mean, you're speaking about abuse cases here, so clearly the significance of this is really vast. So then how are you guys doing and faring in terms of volunteers or even people that want to give their dogs towards such a worthy cause?
The thing we need above all else is, in order to do more good, and we do an awful lot of good, but we are completely limited by the number of dogs and handlers we have. These are our pets. These are not kept in kennels. They're not full-time working dogs. We're volunteers. We need people who've got loving, confident dogs who love people, but you can see who also are quite good with other dogs.
I think Faith just got me the dog handler.
So we desperately need more dog handlers who want to bring their own dogs and have got some time to give to do this work. And I believe South Africa's got so many people who want to do this.
So I can just come with my dog and be taken through what?
We would get you to fill in an application form. We do an evaluation with a professional dog behaviourist. We evaluate you and your dog so that we know that you know what you're doing around a dog. Then you go through a probationary period. You will come on visits and you'll have a mentor there with you and you'll learn how it works. So it takes a bit of time and it does require you to have some time available. We ask for at least, it's not much, an hour a month. One visit a month is our minimum. I do about 2 or 3 visits a month because I have other stuff I've got to do. But if anybody has a dog that you think could cheerfully do this, we would so love to hear from you. We have, we work in Benoni, Pretoria, Johannesburg, West Rand, so we're across central Gauteng.
I'm sure a lot of people will be trying to get a hold of you
please.
after being on the show today. The website is
so
therapytopdogs.co.za. It is on our screen, so make sure that my kids, they're like, Mommy, we want a dog. So this could be it, Jinx. Do you want to come home with me? She's 10 years old. She's an old lady, very
You'd like
relaxed.
her, 'cause
Yeah,
she's
I would.
relaxed.
She's very calm.
She's
I
very calm.
I don't know about
Him, on the other hand.
twos. Terrible twos. I'm worried about this. Okay, thanks for joining us, of course, for this conversation. As you can see, Faith is in her element. And of course, we've been talking to the therapy vice president, Dr. Connor Hughes, along with Top Dog therapy handler, Dr. Claire Aiton, talking, of course, about this Top Dog therapy that they do with Jinx and Eamon hanging out with us this morning right here on Sunrise. Back with more. Yes. Talking. Jinx and I. Picture. Going home with you.
Oh, I saw that. I did. Sunrise.